it to be a really respected Royal College. By the end of my presidency, I'd like it to be standing shoulder to shoulder with all the other colleges, really respected. I'd like it to be something that every single member is really proud to be a member of, but also I think have them feel that it's their faculty, that it's really helping them do the job that they want and they need to do. I think if I can do that, that would be quite an achievement. Well, right at the beginning, and right now in fact I've started already, going around and listening to people. We do need as faculty to prioritise what we do. Public health is such an enormous field. I guess any public health practitioner feels they just get overwhelmed potentially by the breadth of what you can do. So focus is as important for the faculty as it is for each of its members. So what I want to do is to go around, find out exactly what the various committees have been doing, what they think their priorities should be, find out what members out in the field think, listen to them, and gradually build a picture of, in my head, of where I think we should be going and where I think the emphasis could best be. And then when I've got that bit clear in my head, test it out, talk to the officers, talk to the members, and gradually shape a really clear strategic direction that I can sort of stand up and be counted on and really help people take forward. I mean, there is a very good business plan and strategy there already, but I need to understand that better and just really think where my focus needs to be and whether it needs to be adjusted or developed a little bit over time. Well, the challenges I think are legion. One of the biggest challenges, well for me personally, is just working out exactly what's going on and where I really can best direct my efforts to support people. But one of the other things that does trouble me is that an awful lot of faculty members see the faculty as something that's different from them. And you know, I've said it, people say, oh, the faculty does this or the faculty doesn't do that. And I think when we say those things, we forget that we are faculty, that the faculty is made up of its members. Without it, as it doesn't exist. So trying to get that distance taken away, really, and to have members really feeling they're part of the faculty and playing their part in it, and saying what they think, letting us know, but also taking the work forward as a member of the faculty, proud to be part of it. So yes, the challenge is people think the faculty is them and we're something different as individuals. So we've got to get through that. Oh, I think the opportunities are huge. I mean, looking forward and seeing the enthusiasm with which an awful lot of organisations, healthcare organisations, local authorities, businesses, the enthusiasm with which they talk about public health ideas and principles and want help with public health, that's a huge opportunity. But just to perhaps put a little challenge in that, I think there are as many ideas of what public health is as there are organisations wanting to do it. So the opportunity for us is to help them prioritise, come to our views about what we think is best. Let's get some focus, let's get some drive, across the whole UK, across much wider into all the other countries where our members are. So lots of opportunities to learn from what's happening in other countries, to build that into, to share it. Let's get experience and let's really try and move slightly more energetically even on a global front. Public health challenges for this decade, I think, are legion, and very difficult to pick out particular ones. Smoking, I think, is an obvious one. We've come a long way in smoking, but we've got such a long way to go, and still far too many people smoking and putting their lives and other people's lives at risk, not least children, I mean, the manifesto commitment, faculty's manifesto about banning smoking in cars, really important. But we've got to look at that as part of a whole as well, and get the other bits of the tobacco agenda sorted out. So tobacco, obesity, far too many people, too many of us just sitting around too much, not getting up and going, eating the wrong stuff. Lots that needs to be done there, because there is such a wealth of health problems going to develop from all of that over time, and we're already seeing some of that. Health inequalities and the difference between those who are least well off and those who are most well off. We have to do something about that. We've been trying and trying. We've got some good thinking now, really going into what does make a difference and what doesn't. And again, the early years, getting children started in life right is going to be very important there. And finally, coming from what I've just been doing over the last few years, so pandemic influenza, keeping people aware and prepared for disasters and emergencies and infectious disease, making sure we've all got our business continuity plans in place at home and the office. It's easy just to forget when nothing's happening, but suddenly it comes and strikes you, and being prepared is really important. It's been a fascinating, totally fascinating career, hard work a lot of the time. Sometimes I've wondered what I'm doing here, but a lot of the time really interesting and really good fun. I enjoyed my time as Regional Director of Public Health in the East Midlands, particularly when we've managed to get the regional organisations really working together and understanding what public health was, and a really great public health network there to work with and through, so that was good fun. But last year, the flu pandemic, I was asked several years ago to come down to the Department of Health and work full time there, preparing for a flu pandemic. I really didn't expect one to happen while I was there, and having to put your plans into action and to do that and operationalise things in the space of what was literally just a few days at the beginning, but then keep the momentum going, adjust the plans, get the strategies in place, develop stockpiles, help the NHS. Doing that over a sustained period of time, incredibly challenging, but what an opportunity. And very few people, even in public health, are fortunate enough to have that experience at any time in their career. So for me, that was a real highlight. Great people to work with, great support, and just an amazing time. A personal highlight? That's the hardest question. I think I can tell you a personal ambition. I have a garden in the Peak District, which I'm very fond of, but don't get nearly enough time to do what I should in. And I think a real highlight in my life would be to see that garden once free of weeds. That would be absolutely fantastic.